Good evening. Welcome to our Game Changer session, where we'll be talking about domestic resource mobilization. My name is Dr. Sheila Macharia, and I am the Managing Director for the FP 2030 East and Southern Africa Regional Hub. And with me this evening to discuss this important subject are two friends and colleagues. And I'll begin on my right. This is Ayman from UNFPA Supplies Partnership. And on my left is Tomoko from IPPF. Increasingly, we notice that countries are beginning to invest in their family planning programs. And what we want to discuss this evening is why that shift is important and what we need to do to keep the transition moving forward. So I'll begin with you, Tomoko. What are your views on this important subject?
Thank you so much, Sheila. So I think this shift is important because we cannot depend on foreign aid to make better the health of the people in our countries. Health is the center core of countries, the development, the well-being, and it must be with the governments to ensure that this human rights is followed. So we cannot have governments spending on their military, but not spending on the health of their people. So this shift is absolutely crucial. We must see this happen. We also have to make sure that this investment doesn't go all into tertiary hospitals. It goes to the primary healthcare services at the grassroots, where it meets the needs of the people at the grassroots in their communities. As IPPF, we are over 120 locally owned member associations working across 140 countries globally. We are really committed to ensuring that every single person has a client-centered, human rights-based services in their hands that is accessible, affordable, and is timely. Recently, we were very privileged and honored to have been selected to host the FP 2030 Asia Pacific Hub. We are extremely excited to build this momentum together for family planning in Asia and Pacific. We need to bring the spotlight back here. And your question was about how to sustain this. I think for this, the role of civil society is absolutely crucial. If we are really serious about leaving no one behind, governments and civil society service providers must work hand in hand to deliver in the communities. NGOs and civil society such as IPPF. And us civil society, we can also be the watchdogs to make sure that governments are held accountable for their commitments. We can be there to ensure that they deliver to their promises. So I think it is absolutely crucial that we have this government and civil society partnership in sustaining this.
Thank you very much, Tomoko. You bring an interesting point, that being about partnerships. And Ayman, if there's any organization that has partnered and supported countries, it's UNFPA. What are your thoughts about countries investing in their family planning programs and how to keep that transition moving forward?
Thank you, Sheila. I think we are facing a very important challenge if we look at the current unmet need in family planning. I think we are facing a very important challenge when we look at unmet need in family planning. As we speak, we have almost 250 million women who would not like to get pregnant. They are sexually active and they are not using a family planning method. This means that if we do not serve these women, we are not going to be able to reduce and eliminate unmet need by 2030. The investments that are needed to eliminate unmet need in family planning by 2030 are around $65 billion. When you look at how much money donors are committed to spending, it does not exceed $8.6 billion. The rest is either going to be coming from governments or from out-of-pocket payments. So governments need to start looking into how to invest in the best and smartest investment, which is investing in family planning. It has been proven that $1 investment in family planning yields $8.4 in returns in improving health and improving sexual and reproductive fulfillment of the women and the family. So this is where we are now working on redefining our relationship as UNFPA from funding countries to achieve short-term outputs in family planning into financing them to achieve longer-term commitments so they can allocate from their domestic resources to invest more in the sexual and reproductive health of their people by making sure that they provide equitable and sustainable access to modern contraceptives by investing more from their domestic resources and not to continuously rely on foreign aid and donor funding.
And absolutely timely, because for a fact, countries can't continue depending on donors. Tomoko, just to ask, as countries invest in their family planning programs, beyond the role of holding countries accountable, what other role do you see for civil society, for instance? Because many countries will say they're facing fiscal constraints. They have so many things to pay for. So how can civil society enter into that conversation?
Thank you so much, Sheila. And yes, I think civil society does play an extremely important role, especially if we are serious about leaving no one behind in the reaching and achieving the SDGs goals. I think we have to first realize that not everyone can access government health services. There will be people who are marginalized, excluded. There are barriers to achieving, accessing government health services. So that's where I think the civil society comes in hand, where we can go into the communities to actually reach and provide and cater to the needs that is acceptable to them. And we are the ones that need to be there. So absolutely crucial that we have in this role, yeah.
Thank you, Tomoko. UNFPA has been supporting countries and continues to with regard to contraceptive commodities. And somehow it's almost a given that countries expect that support to continue. Given the new environment to the compact, what are you telling countries with regard to commodities as they consider what they need to do for their populations?
That's a very important point, Sheila. By working with governments, we are redefining the relationship from the provision of donated commodities with no strings attached into establishing a relationship that is built on mutual accountability, where both UNFPA and the government are both accountable to ensuring the delivery of contraceptives. So by signing the compact, the government commits to, first of all, the government commits to contributing, albeit a nominal contribution to the cost of commodities that UNFPA provides. So they start allocating resources, and these resources are hopefully incremental. Second of all, they commit to ensuring that they will establish and support the supply chain management systems that will ensure equitable delivery of these commodities, ensuring no one is left behind. Many of the countries that we serve are suffering from gaps between very good access to services in urban areas by educated women versus very underserved areas with low contraceptive prevalence rate and high total fertility rate, especially by those who are living in remote rural areas. So to ensure that there is equitable access and equitable delivery of contraceptives, that everybody and nobody is left behind and everybody benefits from the service, this is the government's commitment that we're working with right now. We are providing them with multiple incentives to make sure that they respond to this, including allowing them to use our third-party procurement systems, providing some match funding for the funds that they allocate so they can gradually increment their funding for family planning.
Thank you, Ayman. And building on the aspect of equitable access, Tomoko, the reality is that even if the government is financing services, there are still women, young girls, men who want their services to come from the private sector. So in your work as IPPF, what role do you see then that civil society or the private sector can play with regards to financing family planning services for those who still would want to access services through that route?
Yeah, so we can support the because we are here as civil society and with donor funding that will cater to the needs of the poor and marginalized. I think we can support in terms of the financing of such populations. And also by the way that we cater our services, COVID pandemic has pushed us into another world of how we deliver services. It has pushed us into really seriously catering for self-care and maybe ensuring that people can have the care at their homes. Also using digital technology, how can we make sure to use these technologies that are available and deliver contraceptives, for example, to the doorstep, making use of online stores or chat boxes or telephone hotlines. I think the private sector and the civil society are more quicker to adapt to situations. We can come up with solutions much faster and also cost-effective solutions that would help in the financing of delivering such services to the people.
Thank you, Tomoko. The complexity of domestic financing for many countries is that they have programs like immunization, HIV, TB, and from all of these constituencies, governments are facing increasingly the reality that they need to begin financing. As UNFPA holds conversations with countries, are you cognizant of that bigger picture and how the different programs will need to be taken on by the country, but is UNFPA helping in that conversation a more integrated way or a very vertical way?
Absolutely. What UNFPA is committed to doing is to adopt a human rights-based approach to health system strengthening. So we are not working with the governments in a siloed, just family planning, contraceptive delivery approach. We are working as part of an integrated systems approach to ensure that the full package of essential health systems services, essential health services are delivered, including sexual and reproductive health, including family planning. And we work with the government to appreciate these other priorities, to look into what the governments can and cannot commit to, and we tailor our relationship accordingly. As you rightfully mentioned, we've just come over the pandemic with all of the deep prioritization of funding away from these essential services, unfortunately, to areas that were related to the pandemic. So what we are doing, we are helping them assess their situation, look into their financial capabilities, their policies, their regulatory and fiscal policies, and we start working on a plan together to be able to incrementally allocate funding as we go forward.
Yes, that's so important to have a broad and comprehensive conversation about it. So, Tomoko, if you were to say one thing that in your position as IPPF, you would want to tell the countries as they move forward, what is it that you would say to them?
So I'd like to go back to my first statement to say, health is a human right, family planning is a human right, and whether a woman and a girl can make decisions about their own body and about their fertility makes all the difference in their life after that. So investing in family planning, as I am mentioned, and this will be central to the country's development and growth. It is the best investment that countries can make. So I would, as civil society, also call on governments to invest in health and also do it in partnership with civil society.
Absolutely. And Ayman, if you had one thing to say to a government, what would you say?
I will say exactly as Tomoko said, investing in family planning is the best investment. Investing in empowering women to make informed choices about their sexual and reproductive health, to make them empowered to make decisions as to if, when to have children, and how to birth space, and how to delay, and how to prevent pregnancy is the best investment to their health, to their social well-being, and their socio-economic status. So the best investment, it's not money lost.
Excellent. Thank you very much, Ayman. Thank you very much, Tomoko. I think that we have the message that it is the best investment when you invest in family planning. Good evening and thank you.